Okay, everyone, let's go ahead and get started. Hello and good morning. My name is Micah Matthews. I am one of the marketing directors here at Messer Financial Group. I want to welcome everyone to our day 2 of our short-term medical week. We've got a lot to go over, and we are super excited about the information that's going to be distributed today. We are joined for the first time ever by Letty Perez and Pivot Health. They are a relatively new company to Messer Financial, so we're super excited to have them join us today and share with all of you. I know a lot of you are currently writing short-term medical, and are interested to see what all Pivot has to offer. So this is going to be the perfect time so you guys have everything that you need and to see what all the options are. After all, we want to do what's in our best interest of our clients, and we can't do that if we don't know what's out there. So this is the perfect opportunity to get a good idea of where Pivot is and what they have to offer. But before we do that, before I hand it over, for those of you that did not attend our webinar yesterday, I kind of want to just recap why I think short-term medical is such a big opportunity and why we decided to do this now. One thing is for sure, regardless of whatever your party affiliation is, we know that this is an election year. And anybody who's been doing short-term medical the past few years know that it has changed dramatically, the landscape in regards to what's available and what is allowed in each state. Currently, depending on which state you are, it varies as far as length of time when policies can be written. Just a few years ago, no state could have a short-term medical that lasted more than 3 months at a time. So that means every 3 months you'd have to go through underwriting again. So it definitely wasn't something that people were really looking for, and it was strictly just for something that was kind of an until basis. Like if you were coming off of a group policy, you'd get a short-term medical policy, and then you'd hold it until you had another job or you found another type of insurance. Well, since then, the market and the landscape has changed dramatically. There's more carriers, more options, more plan benefits, more plan designs than ever before. Depending on which state, it can go anywhere from 3 months up to 3 years. So there's lots of opportunity out there. And I know a lot of you guys are doing Medicare Advantage, and you're also doing ACA. If you've been on any of my ACA webinars, you would know that ACA commissions are great. They're paying, anywhere from, $18, $20 per member per month. That's good money. And it's every single month you're going to get that. But the fact of the matter is, the short-term medical is paying almost 3 times that amount, where you got to figure they're paying on a percentage basis. And let's just say your commission level, now this is a very realistic number, could be 20% depending on the carrier and the state. But let's just say for easy math, 20%. And the average premium for a short-term medical policy is roughly $300. Guys, that's $60 a month per member. Okay? And you can sign up families all at one time. With Medicare Advantage, you can't sign up more than one person at one time. Plus, it's an incredibly underserved market. I know it's very easy, guys, to sell a zero premium to folks, to do Medicare Advantage and sell policies that's even paying you to pay for their Part B. Or with ACA, selling zero premiums for health insurance and having different options. But there's a whole nother demographic. I shared this yesterday in our webinar that not over 90% of people that are enrolled in an ACA plan qualify for subsidies. That what that means, guys, is that if you don't qualify for a subsidy, then you're not getting an ACA plan unless you have some pre-existing conditions. So what does that do for everyone else out there that isn't qualifying for large subsidies, which there's a ton of people out there, over half the population, and are relatively healthy? That is an incredibly underserved part of the market. And I will say this, for those of you that are doing life insurance, you got to think about what kind of clients you're looking for, right? So if you're doing life insurance and you're wanting to write these big cases and all this other stuff, well, what kind of demographic are you looking for? You're looking for people that have money and that are relatively healthy. What kind of person are you looking for short-term medical? Someone that is relatively healthy and that isn't qualifying for large subsidies. So whenever I'm trying to think of what I'm going to offer to a client or what kind of products, I kind of go down the list of that and how to partner these. So not only would you be selling short-term medical, you're also selling or you're actually also growing your book of business for other lines of business, because it all kind of goes together, which is what I love so much about being independent agents, right? We can just keep adding all these different products. Pivot has other products too to align with these short-term medical. And that's what we want to do, guys, because at the end of the day, if you can walk into a client's house who's relatively healthy, that has a lot of money, and you look at their health insurance benefits and you find out they're on an ACA plan and you can save them hundreds of dollars a month, now you've just grown a partner for life. So again, and it's just in any line of business and any way that I've ever seen, anybody who's successful does one thing, and that's put their priorities, their clients' needs as their number one priority. And as long as you do that, they will never leave you, and they'll be able to send you referrals. I mean, you're helping people. Why wouldn't they want to talk to you? People that talk to me, 9 out of 10 times walk away with saving money. So everybody should want to talk with me or you or anybody else out there. And remember, guys, if a client leaves you for another agent, then there's really only one thing that's different, right? Because you can offer everything that this other agent can offer. So what is the difference? Why are they staying with you? Or why do they go with anybody? Because they have that trust factor that you're going to do what's in their best interest. And the only way that you can do that is being educated and informed of what's available out there and being able to partner those products with the correct client. So just wanted to give you a little backstory on that. Like I said, it's the perfect product for an underserved market where agents are really making a killing by offering these products. And we're super excited to, again, be partnering with Pivot on this. So with that, Letty, I'm going to go ahead and turn this over to you and let you begin your presentation on why Pivot. And thanks again for joining us, everyone.
Good morning, everyone. And thank you, Micah, for the introduction. And I concur with all your background on the short-term market. I personally have been in this industry for over 20 years, so I understand the need for the short-term health plans. Welcome everyone, and thank you for taking time out today to get to know more about Pivot Health. We're super excited that we're working with Messer now. And just to give you a little bit of background, just so you understand what and who Pivot Health is. And as Micah mentioned, we are a fairly young company. We launched in 2016. Pivot Health is not an insurance company. We are a product development, marketing, and management company. So we actually create the products and then we put the plans on an insurance company's paper. We are young, but we have many, many years of experience. Those that formed Pivot come with a lot of background and many years of experience in the industry. And we're super excited. In 2018, we were acquired by healthcare.com, which was ranked 583 on the 2019 INC 5,000 fastest growing private companies. So we've got the technology behind us now. And just to give you an idea, the first full operating quarter for Pivot in 2016 was the fourth quarter of the year, and we sold 1,000 apps. We closed out 2019, I'm happy to say, with over 40,000 applications. So as you see, we obviously have quite a bit of experience and have brought to market some really plans that really can accommodate any insured. So just to give you a visual, this is how we see ourselves. So Pivot Health, again, is a product development, marketing, and management company. With that said, we have insurance benefit administrators, also known as Allied National. That was their former name. And I bring this up only because you may see communication once you start doing business with Pivot. And I just want you to understand, they are our third-party administrator. So they handle our policies, our commissions. So insurance benefit administrators, we refer to them as IBA or Allied National. Then we have our insurance carriers. They are the ones that underwrite our products. And then we have our partner networks that we work with and PBMs as well. So just to give you an idea, so Pivot Health's under 65 product suite, and I'm going to Our niche product is our short-term plans, as Micah mentioned, but I will go into a little bit of the other products only because you will see these on your quoting platform. So just so you have an idea of what we have available to offer. So we do have our short-term medical plans, which I will go in detail on each of the plans available today. We have fixed indemnity plans. We have dental and vision plan, and we also have a supplemental plan. And as Micah mentioned, these plans work well together. So you can partner them up with the short-term plans. That's the intent of them. So what makes Pivot Health short-term plans so unique? I understand there, we do have competitors out there, and some of you are selling NatGen and UHC, and everyone has a piece of the market. We all have our own little sweet spots of, what we have to offer. So Pivot Health has a large array of plan designs that can fit all of your clients' needs and budgets. So more than likely, you're going to find something that'll accommodate your client. Our coverage can begin within 24 hours of submitting the application, or you can actually quote and enroll a client as far out as 60 days from the date of the application. So if we were doing a quote today, the system would automatically show you tomorrow, October 7th, as an effective date. So they would technically have coverage starting at midnight tonight. We have extended duration options that allows your clients to select up to two 12-month policies or 2 by 364-day policies. This will vary by state. We also have access to some of the largest national networks. We also have plans that are open access plans, which means there is no network restriction. Your client has the flexibility to go to any provider or any facility. And with those plans, we use reference-based pricing to help reduce the out-of-pocket expense to your client. And I'll be going over that in a little bit more detail as well. Eligibility ages for the short-term plans are 6 months all the way up to 64 years and 11 months. So that's really up to the end of the month prior to the client's 65th birthday when they become Medicare eligible. We have child and children only policies that start from as young as 6 months of age. So you can put a child on a plan at 6 months of age. We also have coverage for high school and college athletes. So all of our plans will cover a high school or college athletes. Some companies do restrict that. And then our plans are backed by A-rated carriers. We currently have 2 carriers underwriting our short-term plans, and I will share those with you as we go through each plan, but both are A-rated companies. I mentioned the extended durations. And as Micah mentioned, a lot of the states do have restrictions. So you would have access in your agent portal in our resource tab to look up and see which durations would be available in a state that you're marketing in. But then you also don't have to worry about memorizing any of this. When you go into the quoting portal, as soon as you enter the zip code, the system will automatically only display the products and durations available in that state. With the extended duration, there's no new application. So when the first policy ends, the next one will start automatically. So one policy ends at midnight, the next one starts at 12:01 a.m. There's no gap in coverage, no new underwriting, no new waiting periods applied to the subsequent policies. And we say that because there are some waiting periods when you start to use the plan. Copays and coverage maximums start over. They are a new policy. Deductibles, coinsurance maximums also start over. And then I will be showing you how to select the extended duration option when you're enrolling a client. This is also a chart that you would find in your agent resource tab, and this is just giving you the guidelines of what the availability as far as durations are by state. And then there are some states that have restrictions on how many times a client can have a short-term policy, and some require a waiting period. So all of this will be in your Pivot Agent portal. So the short-term plans that Pivot Health has to offer, we have our core plans. Core plans are a passive PPO plan. We have our classic plans. Classic plans, there are 4 plans under that category, and that category is just essentially, those are our open access plans. So there is no PPO network tied to those classic plans. Then we have our newest plan, which rolled out at the end of June, called Epic plans. With that Epic, you have the option of using a Cigna network or selecting the plan that has an open access, no network restrictions. We also have our quantum plans that just turned about a year old now. And then we have our Bridge to Medicare plan. And that's a plan that we designed specifically for those last couple of years before Medicare eligibility. So with our Epic plans, this is actually a screenshot of our Epic plan brochure. So as you see, you've got the Epic PPO plan. That's the plan that will utilize the Cigna network. You have the Epic base plan. That is going to be your open access. So there is no network restrictions on it. Keep in mind, these are 100% coinsurance plans. So once the deductible is met, the plan will kick in. Some of the other benefits that you would receive is there's a preventive examination coverage, which will offer, after a 3-month wait of being on the plan, 1 primary care visit and services covered at 100% up to $100. And that's per covered person per coverage period. The middle column in your brochure is essentially just showing you if the client is on the Epic PPO plan and they opt to go out of network, how their benefits would vary. Now, of course, it's always going to be most cost effective for them to stay within the network if they're on the Epic PPO plan. Again, you have some coverage as far as there's a supplemental accident option that can be added when they're selecting the plan during enrollment, and essentially they get to pick either a $5,000 or a $10,000 benefit. And what that supplemental accident coverage offers, if the insured happens to get injured in an accident while on the plan, and they require immediate medical attention within 72 hours of the accident, the plan will pay up to that benefit amount that they selected towards that injury, which is a really nice benefit, considering with an incident like that, they can easily go through their entire deductible. That would be an out-of-pocket expense for them. Also, the Epic plan offers coverage if the insured is traveling outside of the United States. Most of the short-term plans only offer coverage within the United States. So if they're traveling outside of the US and have an emergency and require immediate medical attention, they would have benefits. And then there is a prescription drug benefit option that they can add on. They have to make sure they select the plan that will include the prescription benefits. The prescription benefits utilizes the Cigna PBM, and there are no deductibles to be met to use the prescription benefit, and the generic copay starts as low as $5. So the plan is very rich in benefits. Keep in mind in your brochure, which the brochures can all be found in your agent resource tab, or also during your quoting experience, you will have options to view the brochure. If the client is looking at the Epic PPO plan, you do have a live link in the brochure that you can open up so that you can look to see if their provider is in that network. So let's recap what makes the Epic plan so unique. Again, they're a 100% co-insurance plan available. We've got plans with $5,000 out-of-pocket maximums. One of the features not shown on that brochure, but with the Epic plans, they get a free and unlimited telemedicine benefit, and that is for every insured on the plan. So that's a big plus, where our telemedicine cost is $49 per consultation. For the Epic members, it is free and unlimited. Again, the Epic PPO plan utilizes the Cigna PPO network as well as the Cigna PBM. And then the Epic base plan uses the reference-based pricing because there are no networks, and it allows to offer a large savings to the insured. Again, you have to select the optional prescription copay drug card, which has no deductibles. And we mentioned that it includes contraceptives. Why? Because the other plans we offer that have prescription benefits included do not cover contraceptives. A preventive wellness coverage for the whole family, including prostate and colon cancer screening, mammograms, and OBG annual exams. Child immunizations on the Epic plans are paid at 100%. That's a big plus on these plans. The optional supplemental accident plan that I went over with the benefits, they can select either a $5,000 or a $10,000 benefit. The coverage when traveling outside of the United States on the Epic PPO plan offers them coverage. And the Epic plans are underwritten by North River Insurance Company. And North River Insurance Company is an affiliate of Crum & Forster. And North River was rated an A company by AM Best in 2019. So again, North River is the carrier for the Epic plans. The plans are administered by Insurance Benefit Administrators. Our TPA handles all of our short-term plans. And any of the non-association benefits are covered by Communicating for America. I mentioned there are some waiting periods. So for the Epic plans, when the plan goes in force, there is a 3-day wait for sickness. There's a 30-day wait for a cancer diagnosis. And then for that preventive exam benefit, that up to $100, there's a 3-month waiting period for that benefit. Then we have our core plans. As I mentioned, the core plan is a PPO plan that utilizes the First Health Network. The difference in these two plans would be the deductible amount and whether or not the prescription coverage is going to be a discount program, which would be with the Core 1000, or an actual insurance with the Core 2000. These plans offer the low deductibles, low co-insurance max out of pocket. Keep in mind, you have to add to that co-insurance max out of pocket the deductible. The total coverage on these plans are $750,000, and that's per coverage period. It is not a lifetime maximum. Also, I do want you to note that these plans offer an office visit copays. Keep in mind, for any of the plans that we offer where office visit copays are included, it is 3 visits per coverage period per insured, and that's a combination. It's a total of 3. So if they go to a primary once and they go to an urgent care twice, they have utilized their office visit copays. Do note that on the core plans, the hospitalization benefits are fixed. So what does that mean? For example, if the insured ends up being confined to the hospital, the plan will not pay more than $1,000 per day, and that would include room and board and any miscellaneous charges. So you want to make sure that that is explained to the client, that they may have some exposure to additional out-of-pocket expense in addition to their deductible and coinsurance max out-of-pocket if they happen to use the hospitalization benefits. So to recap the core plans, again, PPO plan, First Health Network, but keep in mind the core plans are a passive PPO, which means if they go out of network, they will have benefits, and we will use the reference-based pricing to help with those out-of-pocket expenses. Low deductibles. The coinsurance max out-of-pocket, again, does not include the deductible. You have to add that in. And then you have the fixed hospitalization benefits. Doctor office visit copays, prescription drug benefits, one being a discount, one being an insurance. And the core plans are underwritten by Companion Life Insurance Company. So the carrier for the core plans is Companion Life. They are also an A-rated company, and they've been in business for over 40 years. Then we have our classic plans. Like I mentioned, classic plans, there is not a plan actually called classic. It's a category that we put these open access plans into. So we've got 4 plan choices with no network restrictions, freedom of choice. They can use any provider or any facility. And this is where you're going to get the largest amount of options when you're running a quote, because these plans have so many different plan designs, and it's based on what you're looking for. So you have deductibles that start as low as $1,000 all the way up to $10,000 based on which plan you select. 2 of the plans, your choice and your deluxe, are going to offer you office visit copays. Again, as I mentioned earlier, it's 3 visits per insured per coverage period. You've got 2 plans, the choice and the economy, are going to offer discount programs for the prescription benefits, where the deluxe and the standard are going to be an actual insurance. One requires the standard that you meet the $500 deductible before the copays kick in. With the deluxe, they get their generics at $10, and then the deductible, $500 deductible, comes into play for the preferred and non-preferred drugs. You've got coinsurance max out of pockets as low as $3,000 all the way up to $10,000 based on the plan you select. Keep in mind that's the coinsurance max out of pocket, and you do have to add the deductible to that dollar amount. And then with respect to the maximum coverage for the coverage period, you can select as low as $100,000 all the way up to $1 million. So this is, again, where you're going to get your largest amount of selections when you're running a quote. So you may want to narrow it down if you know specifically what a client is looking for. So just to recap again, the classic plans. Again, a lot of options. You have prescription coverage options, doctor office visit copays, and coverage up to $1 million for the policy term. You have coinsurance max out of pocket does not include the deductible. The classic plans have no network restrictions. Freedom of choice with balance bill protection, and I will be going over that when I go over our reference-based pricing. The classic plans are also underwritten by Companion Life Insurance Company. So reference-based pricing, for those of you who have been in the group market, you may be familiar with this. With the years I've been in the short-term business, this is the first time I've actually worked with reference-based pricing. So essentially, Pivot Health will pay up to 125% of the Medicare allowable for a physician and up to 150% of Medicare allowable for a medical facility. Keep in mind your client doesn't have to do anything special. Their ID card has all the information on it. They should present their ID card at the time of their visit, and the provider will submit the claim to insurance benefit administrators for processing. The claims are going to be repriced according to the percentage of Medicare allowable. Okay, the payment is made to the provider. On average, the savings with reference-based pricing is about 68%. So that's even a steeper discount than some of the PPO network discounts. The member will receive an EOB, explanation of benefits, which will show the discounted amount. The balance bill protection I mentioned. So the member will not be responsible for a balance bill due to the discount. So if they should happen to get a balance bill from the provider or the facility, they can send that bill into IBA for processing. We actually have a team that will negotiate with the provider. And if they cannot come to terms with the provider, Pivot Health will pay for that balance bill. So that's pretty big. And our numbers are amazing. The success rate for 2019, about 96% of the bills all went through with reference-based pricing, and only 1% had to be renegotiated. So just to give you a quick example of how this reference-based pricing works. In this example, we have a 59-year-old in Nebraska that required an MRI. The billed amount was $1,060. It was determined that the Medicare allowable charge for that MRI in that area was $222.72. And then with the reference-based pricing at 125%, the acceptable amount was $278.40. In the example where the deductible has already been met by the insured and they're now meeting their co-insurance max out of pocket, so they would be responsible for 20% of that $278.40, making it $55.69. Had the deductible not been met yet by this insured, they would have been responsible for the $278.40. So just to give you an idea of how steep of a discount there is with using this reference-based pricing. Then we have our quantum plans. Our quantum plans are a Cigna Network PPO plan. This is also a screenshot of the brochure. Column 1 is showing you what the high deductible plan would offer. Second column is the PPO copay plan, which is going to be the richer of the two plans. And then your third column is going to show you how the benefits would differ if they went out of network. The quantum plan also includes a preventive health exam. It's one visit per coverage period, not to exceed $250, and that's per insured per coverage period. It also offers some wellness. Routine annual OBG exams, for example, are subject to deductible and co-insurance. And then you have prescription benefits. So on the Quantum PPO high deductible plan, it's going to be a discount program only, but the Quantum PPO copay plan is going to offer copays starting as low as $5 with no deductibles to be met. And keep in mind also with the Quantum PPO copay plan, you're also going to get the 3 office visit copays. So again, and it's 3 visits total combined. With the Quantum plan, there's also coverage when traveling outside of the US, similar to the Epic plan. And then with the Quantum plan, the supplemental accident benefit, this is not an option. This is already built into the plan. And essentially what it means is that if the insured is injured in an accident and requires immediate medical attention within 72 hours of the accident, the plan will pay up to 100% of the insured's deductible. And again, this is a built-in benefit. It does not have to be added at the time of enrollment. So just to recap our Quantum plan, we have the Cigna PPO network, and we utilize the Cigna PBM for the prescription benefits. Keep in mind the plan is underwritten by Companion Life, and we are not affiliated with Cigna. We just have an agreement with them to utilize the network. It does include the preventive health benefit, at up to $250 for that one visit. We also use reference-based pricing if they should go out of network with the balance bill protection. In the case of the quantum plans, the out-of-pocket maximum does include the deductible, unlike the other plans where you have to add on the deductible to the coinsurance max out-of-pocket. The doctor office visit copays are available on the quantum PPO plan. And the quantum plan also offers coverage for organ and tissue transplants and coverage when traveling outside of the US, similar to the Epic plan. If they require immediate medical attention and they are outside of the United States, they would have coverage. And again, Companion Life is the insurer of the quantum plans. We're really excited. We just recently rolled out this new mobile app feature, and this is going to be for your clients. So when the insured enrolls in a plan, they get a welcome email, gives them instructions how to log into their member portal, and now they'll have instructions how to download their mobile app so that they will have with them at all times their ID cards and their policy documents. Very convenient feature. Our 60 plus strategy. Pivot Health realized after doing some market analysis that we have a large market of people in that last couple of years before the Medicare eligibility age. We show all the plans because we want to make sure that you keep in mind that all of the plan, short-term plan options are available all the way from 6 months, 6 months of age all the way up to 64 and 11 months of age. So the Bridge to Medicare plan was created for those self-employed over 60 or a spouse of a Medicare recipient who's not yet eligible for Medicare, over 60 that wants to retire but can't afford that health care. ACA, it's a great ACA alternative, as Micah mentioned earlier. The ACA plans are very expensive in that age bracket. So the market today, we've got about 12 million of the 77 million baby boomers born between 1954 and 1972 in the US are between the ages of 61 and a half and 64 and a half. That's about 28% of the population today. And then we've got about 10,000 people turning 65 every day, and this is going to continue into 2030. We've got about 45% of baby boomers consider themselves to be entrepreneurs. So if they're self-employed, they don't have access to group or employer coverage. So that means they're on their own. About 50% have incomes that might not make them eligible for a subsidy for an ACA plan. And then for the statistics on Pivot, in 2019, about 9% of our membership was made up of customers that were over the age of 60. So far this year, and this number is probably higher because this number was captured a few months ago, about 16% of our membership is made up of that over 60 market. So just to show you that there really is a need for an alternative to the ACA. So our Bridge to Medicare plan, very easy. It's 3 plan options. You're not going to have an array of different combinations that you can switch around. It's going to be either plan 1, 2, or 3. They are already determined for you. But with the Bridge to Medicare plan, the client gets automatically 3 364-day plans back to back without having to reapply, and they don't have to select an extended duration. This comes automatically with the Bridge to Medicare plans. So again, same kind of benefits. There's no application in between. If a condition develops during their first coverage period, that particular condition will be covered in the subsequent policies because there's not going to be a new application in between. It will not be considered a pre-existing condition. We have added association benefits that include telemedicine. The telemedicine for the Bridge to Medicare members is essentially free. If they use the telemedicine benefit, they can submit their receipt showing they paid the $49, and we will reimburse them for that bill. So they essentially don't pay anything for telemedicine. The Bridge to Medicare plans include prescription benefits. The premiums are much more affordable than an ACA plan. And the Bridge to Medicare also has open access. There is no network. So your clients at this age range, most of the time, have doctors that they're comfortable with already and don't have to switch to use the plan. So just to recap again, and this is just an option. It is not available in all states due to the durations that the plan offers, because it offers up to three 364-day plans. It includes the association benefits, as I mentioned, the reimbursement for their telemedicine. There's no network restrictions. Again, there's no gap in coverage. One policy ends, the next one starts immediately. There's no new underwriting, no new waiting periods applied to the subsequent policies, no new pre-X look back for the next policy. Their deductibles, co-insurance maximums do start over. Each plan is a new plan. Coverage maximums also start over. And then the Bridge to Medicare plans are insured by Companion Life Insurance Company. This is a little flyer that was put together, and I think it's very helpful. You'll find it in your quoting platform as well as in your agent resource tab. We've kind of given you a little bit of maybe let's call it a cheat sheet. So if you've got a specific client, let's say it's a college student and they are no longer going to be covered on their parents' plan and they're looking for something for catastrophic. These would be great plan options for them. So just to kind of give you an idea what the features would be and how they would suit that particular client that you're working with. And again, it's available in your quoting site as plan options. So you can take a quick look at it before you start running a quote. Our ancillary products. I'm going to run through these because some of these products are available to add on when you're selling a short-term plan. We have our standalone or add-on Brilliant Dental and Vision. Our Brilliant Dental plan is underwritten by Renaissance. It is a PPO plan. When you select the dental plan, whether you're selling it now standalone, and I say now because when we originally rolled out the dental plan, it was only available as an add-on product. Now it's available standalone, so you will have a tab to quote and enroll just a dental plan. The vision option is only available when they purchase a dental plan, so you cannot purchase vision by itself. Eligibility ages for the dental plans. If you're doing a child-only plan, you will not have the option, if the child's under the age of 18, to sell them a dental plan. But if you're selling a short-term plan and there's children as dependents on the plan with adults, they do have access to all the benefits. So they are eligible if they are dependents on a plan. There's no waiting periods for the benefits on these plans. When adding it on to a short-term plan or a Bridge to Medicare plan, the effective date is going to coincide with the effective date selected for the short-term or the Bridge to Medicare plan. And some of the benefits and annual maximums do increase at the beginning of the first 3 coverage periods. So it's a progressive plan. Keep in mind, this is not a discount program. It is an insurance. Routine cleanings are paid at 100%, and it offers benefits for basic and major services, including fillings, extractions, crowns, and implants. The vision coverage is through PIVOTCARE, and it is also a PPO plan, and there's only one vision option to add on. Then we have our Latitude plan. This is also available as a standalone product. There's a tab on your quoting platform that will say supplemental. That's our Latitude plan. The Latitude plan is a packaged accident, critical illness, hospital indemnity, and accident, death, and dismemberment in one plan. So originally Latitude was a standalone product only. We did add it on so that you can check the box and add it on to a short-term plan. A lot of agents will do this. It helps with that out-of-pocket expense when they're meeting deductibles and co-insurance max out-of-pocket in the case of an accident or critical illness occurring while on the plan. It's a bundled package of critical illness, accident, death, and dismemberment, and hospital indemnity. This is our only guaranteed issue plan. Obviously, if you're doing a short-term plan, that doesn't matter because they'd have to be eligible for the short-term plan. But when selling it standalone, there will be no medical history questions on it. When you sell it standalone, the client has to be, again, over the age of 18. If they are under 18 and they're a dependent on the plan, they can have the benefits. The cash benefits from the Latitude plan are paid directly to the insured, so they can use that money to reimburse themselves however they choose. It does not have to be assigned to the provider. And we are going to be adding some new benefits to these plans. So make sure that you pay attention when you get communication from Pivot Health. We try to send out email communication to our contracted agents with any updates to existing products or any new states where products will become available or changes to our platform. And with the Latitude, there's going to be only 2 plan options, your Select and your Preferred. For those of you who have maybe not yet gotten contracted with Pivot Health, your contact obviously at Messer will help you with that. Once you get your code, you'd go to www.pivothealth.com to register. Your agent login is going to be the Pivot agent writing number that's assigned to you. This is our new platform. We just updated our website. If you click on Book of Business, if you've already been selling, you will have access to all of your clients on that page. You can also open up and have access to their ID cards, their policy documents in PDF. The example here I'm going to start with is going to be the short term, just to give you an idea how to run through a quote on a short term plan. So obviously here you would select Get a Quote, and it's going to give you these plan options. Now, keep in mind that this needs to be updated. We now have a dental tab at the top. So the supplemental would be the Latitude plan, fixed indemnity plan. I will give you a briefing on that in a second. And then our Bridge to Medicare plan. We're looking at the short-term plan. In this example, we've used Florida as a zip code. Click on See Our Plans. The zip code will carry over. That is just triggering the system to only offer plan durations that are available in that area, as well as the products. On this page, you would need to populate the date of birth, the gender, and the first name. You do not have to enter an email address on this page. This will not trigger an emailing a quote to them. That's a different screen. Your desired start date. As I mentioned, if we were on this live, what would be displayed on here would be 10/7 of 2020. There's a calendar here to the right of the desired start date box. You can select as far out as 60 days. Keep in mind, this system will not allow you to quote further out than the 60 days. Just as a note, when selecting and submitting an application, whether the insured selects tomorrow as a start date or 30 days or 45 days or 60 days out, their initial 30-day premium will be drafted immediately, regardless of the effective date selected. So you want to make sure that the insured understands that their initial draft is going to happen immediately once the application is submitted. Going forward, their monthly charge will happen based on their effective date. So we actually draft twice a month based on the effective date. So if your insured has an effective date from the 1st of the month through the 19th of the month, their draft is going to happen on the 10th of each month going forward. If their effective date falls between the 20th and the very last day of the month, their draft date is going to happen on the 22nd of each month going forward. So you just want to make sure that they understand that. The draft does not coincide with the date of the effective date of the plan. If there's more than one effective duration available in that area, it's always going to default to the longest duration. If they are looking for a 180-day plan, you would have to select that. Click on Find Plans, and on this page, I highly recommend on the left-hand side, you get comfortable with the filters. The filters will help narrow down the plan options. You are going, if you initially get to this page, you're probably going to see anywhere from 40 to 50 different plan options. That can be quite overwhelming for a client, as well as very time consuming for you to scroll through. So if you already know what plan you're interested in sharing with this client, you want to use the filters on the left-hand side to narrow it down. If you're working with a client over the phone and they want to see some plan options, you can use the compare plan option, select any up to 3 plans. The banner on the top of the screen opens up in that dark blue, and you'll have the compare 3 plans button. You would click on that, and that'll take you to a screen that'll have the 3 plans selected side by side, and it displays the differences on the plans. You still have the option here to email this quote. Keep in mind, currently the system will not store the quotes that you've created for your client, but when you send out the email, you as the agent will get a copy of that email. And in the email, the client, both you and the client, will have static links inside where they have the option to view brochures. They can view more details on the plan. They can actually select the plan and start the enrollment process. If you select one specific plan and you click on View Details on the initial page, this is the page where you're going to have the option to extend the duration. So if this window does not open up, that would mean that you're in a state that does not allow an extended duration. Okay, and if you notice, the application summary on the right-hand side is just capturing what came over from the prior page. So it's a 364-day policy. In this example, we're showing the EPIC plan, the EPIC PPO. I mentioned the supplemental accident rider. This is the page where they would need to select that option. If they don't, you cannot go back and add it on after the application has been submitted. So it's very important that you select it at this time. You also have the option to add the dental and or the latitude plan at this time. Once all the selections are made, the next screen is going to update. As soon as you click on them, the summary is now going to show you that you've extended the duration. It's now going to be 728 days. It's also going to show you all the new premium because you've added on the accident rider. And in this case, they've added on the dental. And if they want to still review this, you have the option of emailing this one specific plan choice with all the options that you've added to it. So this is what the email would look like. You again get a copy of it so they can review it. They can look at the brochure. They can decide if they want to move forward with the selections you've made for them. Keep in mind that with the short-term plans, these are simplified underwriting plans. So there's not going to be any additional underwriting done after the application is submitted. The client has to answer no to all the questions in order to move forward. If they select yes on any question, the system will stop them and let them know that they're not eligible, and they'll refer them back to you. We do not ask the tobacco use question. We also do accept type 2 non-insulin dependent diabetics. So the only knockout would be if they are a type 1 diabetic, insulin dependent. So I believe some of the other carriers do not accept diabetics at all. Also, we do not ask for a social security number. So they only have to be able to answer that they have resided in the United States for the prior 12 months if they're not a US citizen. Once they get to their, they complete the questions, it'll take them to the contact information page. This is where they're going to submit their payment information. And even at this point of the application process, they still have the option of changing the coverage period. So if there'll be an edit button next to their coverage period that will open up the calendars. They can change their start date. They can change their end date. It'll automatically update the number of days of coverage. If they use that feature or you use the feature for them, please make sure to click on the save button. If you do not, it will automatically revert to the original selection. Keep in mind that these plans do accept an electronic signature. So they do need to read through and accept that they acknowledge that this is not an ACA plan and what they're purchasing. Again, once they hit submit, you will get an acknowledgement that the policy went through in case they did it without you assisting them. And they get a welcome email, again, with the instructions how to log into their member portal, download their documents, as well as how to download the mobile app. I've mentioned the telemedicine. So in most states, our plans are filed through an association called Communicating for America that offers non-insurance benefits. The telemedicine is doctor on demand. Keep in mind for the Epic plan, it is unlimited and free. For any of the other plans where it's offered, it would be a $49 charge. That would be an out-of-pocket expense to the client, does not go towards deductible or coinsurance. Or for the Bridge to Medicare members, they get to use the doctor on demand, submit a receipt, and we will reimburse them their $49. And with the association benefits, they get discount on prescription drugs, as well as vision and audiology. We do have our fixed indemnity plan. We have our PIVOTCARE Elite. These are plans that offer no deductibles or coinsurance. Some of the benefits depending on which plan they select. For example, daily inpatient benefit can be up to $3,000 for a sickness, $6,000 for an accident, a day for 365 days a calendar year. There's ICU benefits, again, $6,000, up to $6,000 for a sickness, up to $12,000 for an accident injury, a day for up to 30 days. There's critical illness coverage for things like invasive cancer, stroke, heart attack, end-stage kidney failure. It also includes accidental death benefit and a common carrier life insurance benefit. Depending on the plan they select, they can actually get up to $125 back to them for a one-time wellness visit per calendar year. Additional benefits are for fractures, dislocation, burns, and more. Keep in mind this plan is not an add-on when you're selling a short-term. There is a full application that has to be completed for the PIVOTCARE Elite, but we did just update it so you can actually run through the verification call with your client with an easy script to go through the questions and make sure they understand what they're purchasing. But a lot of agents will stack a limited benefit plan on with a short-term plan because, again, it will help with that out-of-pocket expense while the insured is meeting deductibles and coinsurance. Pre-existing health conditions. We want to always reiterate that these plans do not cover pre-existing conditions. So if they have a condition that maybe was not a knockout question on the application, and on that application, it is a 5-year look back on certain conditions. But we just want to make sure that the insured is aware that, that don't have expectations of getting coverage for something that already exists, even though they qualified for the plan. So you want to make sure you go through that with them. We have an awesome bonus program going on right now. Just started October 1st. This runs through the end of the year. If you need more information on it, feel free to reach out to Micah. He'll have the flyer on it with more details, or you can reach out to me. I'll be more than happy to share it with you. So just a nice little incentive from here through the end of the year. And Pan American Life. You may see communication coming across from Pan American Life. For those of you that sell Medicare, we do have a Medicare supplement plan underwritten by Pan American Life that you can also market. Again, if you're interested, feel free to reach out to Micah or myself, and I will put you in contact with the rep that handles that. Again, I wanted to thank everyone for taking out the time to get to know a little bit more about Pivot. I hope this was helpful. And I will allow Micah to go through any questions that we may have, and I'll be happy to answer them.
Letty, thank you so much for sharing the information for Pivot. It sounds like you've got a lot of great products, and especially I like how you guys cater to a specific thing. And I know there's a lot of agents out here that do Medicare Advantage that sign up a spouse or something, and then the other spouse is not Medicare eligible yet. So there's going to be tons of cases where that fits in, and it seems like they have a plan for just about everyone. We do have a few different questions. For one, can you post back up that slide that shows the term lengths by state?
Absolutely.
I know we had some questions about what was available in North Carolina. So when you said that you do not cover pre-existing conditions, that's forever, correct? Like once it's a pre-existing condition, they won't have that covered.
Yes, and there's that fine line of a 12-month look back versus a 5-year look back. But in most cases, because our plans are only 364 days, they'll never pass that 1-year threshold. So
gotcha.
Correct.
Okay.
Yep.
Are your renewals, do they automatically renew, or is it something that they have to apply again?
No. So if they do not do an extended duration at the time of application, they would have to do a new application. So they'll get an email reminding them that their policy is terming, but they would have to go in and do a full new application.
Do the bridge plans have any kind of maximum? Do they have $1 million max or anything like that?
Bridge to Medicare is, I believe, 500,000. I'm sorry, I don't have it in front of me, but I'm pretty sure it's 500,000. I'll take a look at that. So this is not actually. There is another screen that has the, and I don't have it up here. I'm sorry. But we have a page with the state availability. So some of our top selling states are Arizona, Florida, Texas, Georgia, North Carolina. So there are products, and this, if you're seeing a duration availability here, that means we have product there. It may not be all of the plans, but there is product available, and this is on the short term only.
Do you have any kind of underwriting guide or anything of what would be declined or which ones wouldn't be, or is that just kind of
Yep. Actually, I can send you over. It's in the training platform under, it's a producer guide, but each of the plans. So there's a couple of questions that are a little bit different when it comes to, say, the Epic plan and the Quantum plan. But it's a five-year look back with certain conditions such as cancers, heart things. Again, the diabetes question is type 1 only, because we do take type 2 diabetics non-insulin. But I can get you that guideline so that you can share it. weight limitations for our plans are over 250 for a female, over 300 for a male. There are no height requirements. Pregnancy is definitely a knockout. If they're pregnant or trying to get pregnant or in the process of adoption, they would not be eligible. So that's one of the questions on the application. And obviously they cannot have another coverage in force. And they cannot be eligible for Medicaid or Medicare.
How is Pivot handling COVID? Do they have any coverage for that, for the testings or anything?
Absolutely. The test is covered at 100% if prescribed by a doctor. And then if they're admitted, it would be handled like any other illness based on the policy.
Does telemed, are they able to prescribe medications?
Yes.
And actually, I have a good example of that. My daughter, for example, she had pink eye, and instead
Hmm.
of me having to call a physician and try to make an appointment and wait a couple days to be able to get in, I called the telemed people,
Yep.
and within 15 minutes, I had a physician calling me back. We were able to do a face chat with him. He
Yep.
prescribed the drops for her to get. Went right over to the pharmacy, and within an hour, I had my prescriptions in hand. So yeah, I would definitely highly recommend taking advantage of that. And plus, since COVID's come out, they've done leaps and bounds improvements on
Correct.
telemed services. So I really think that's going to be the future.
Absolutely. Yes, of
Um,
course, there are limitations as far as prescriptions when it comes to certain controlled drugs that they limit, but you can refer to the telemedicine, guide when they enroll to see what limitations there are.
Let's see. Someone was asking when the broadcast will be available. So we post all of our webinars on our website at messerfinancial.com. Usually the following Tuesday from the following week Tuesday from when we present. We have been able to get them on a little bit quicker lately, but I would say no later than next Tuesday. This should be available. Um, Let me just see if there's anything else. It looks like that might be it for the questions right now. If you don't have a contract or you're not yet appointed with Pivot, obviously you're going to want to add them to your portfolio. You can do that by going to our website, messerfinancial.com, going into our online contracting, which is Surance Bay, and requesting your appointments, and that will begin the whole process. Letty, again, I appreciate all your time today and sharing all this information with us. Is there anything that you
Absolutely.
wanted to say in parting?
No, feel free, Micah, if anyone has any questions once they get contracted, they need assistance logging in or, navigating through the portal, feel free to reach out to me. Any product questions, I'll be more than happy to assist.
And if
I
and
am,
if an agent does have questions about pivots directly, who should they contact? What's the best contact for
that would be me. I'm your
them?
designated broker account executive. So I was assigned to Messer, so it would be me.
Terrific. Do you have your contact information anywhere on here?
Actually, I should have put a screen up there with my contact information. I will read you. I apologize. My phone number is area code 727 502 6827. And my email address is Letty, Letty dot Perez, Perez at pivothealth.com.
And again, guys, this webinar will be posted on our website next week. So make sure if you missed anything or want to go back and review it or whatever the case may be sure to do that. And if you have any questions, concerns, anything, don't hesitate to contact us at Messer Financial directly. We are here to help you guys, and we want to do everything we can. Obviously, there's a big opportunity ahead of us. And I'll tell you what, we don't know what's going to happen next year. This election could change everything. So make sure if you got anybody that's interested in a short-term medical policy, something like this, or a bridge plan, or whatever it is,
Mm-hmm.
lock it in today because we don't know what tomorrow brings. So again, everyone, I thank you for your time. Have a great week, and be sure to tune in next time for our next webinar. Thank you, everyone. Take care.
Thank you.